Pleasure to be here interviewing Dr. John Cooke, who is the chair of our Cardiovascular Sciences Department. John, you just gave a spectacular talk on the potential therapeutic role of RNA. Where do you see this going? I mean, what are the technological barriers? What are the big breakthroughs that you're going to have to see technologically before this can actually be used meaningfully in the clinical environment?
So, interference RNA is something that's already in clinical trials. We are generating modified message RNA. So it's the difference between putting on the brake versus stepping on the accelerator. We're stepping on the accelerator. We're trying to make therapeutic proteins. We are already moving toward the clinic by enhancing cell therapies that are already in existence. So we're working with a company right now to improve their skin cell therapy for burn patients. Geriatric patients, skin cells don't replicate very well. And in this case, we're using RNA encoding telomerase to extend the telomeres in those keratinocytes to see if we can't improve the replicative capacity of those skin cells, which would be useful for geriatric burn patients. We're doing something similar with chondrocytes, for autologous chondrocytes for cartilage restoration. So I think that we can, with respect to improving cell therapies, we're actually moving toward the clinic now. With respect to delivering RNA systemically to a person, there are hurdles that we have to get over, and the major one is delivery.
I work, of course, in the endovascular world, and as you talk about delivery systems, obviously we've got to be able to test these concepts in a controlled environment. And I think about drug-eluting balloons. We now have the ability to deliver a drug in a fairly contained environment into targeted areas in a blood vessel. Any ideas that we could actually deliver in this kind
That's
of
actually a spectacular idea, and you and I should probably sit down sometime over a beer and talk a little bit, brainstorm a bit about this, because that actually might be a nice way to deliver RNA locally. Now, the advantage of that, of course, is systemic exposure to RNA triggers innate immune response, and that could cause a substantial amount of inflammation, release of inflammatory cytokines, a cytokine storm. So there could be some toxicity of delivering RNA systemically. If you can deliver it locally like that, you can find the RNA to a certain space and you can treat a certain area. I like that idea. Another approach that we're working on with our nanotechnology colleagues is to deliver the RNA in nanoparticles that will protect the RNA from degradation. That is another hurdle, is the RNA is unstable when exposed to RNA ACEs, proteins that break down the RNA. So we're working with our nanotechnology colleagues to incorporate the RNA into nanoparticles. We've done that successfully, and now we're seeing if that will enhance the delivery systemically in animal models and reduce any toxicity.
That's fascinating. But let me change tack a little bit. I'm always fascinated by how people build programs. Now, you had a very successful program at Stanford. You rolled the dice. You moved to somewhat untested new organization here at Methodist, and you've built a spectacular program, and you brought a lot of people here who traveled with you. And that's always a hallmark for me of a good leader. Tell me how you did this. Why are you being as successful? And I want you to take off your modesty cap when I ask you these questions, because it's potentially a lesson for all of us.
Mm-hmm. Well, I would say, Alan, I'm glad you asked that question, because I got a great opportunity, and that's why I came. I was at Stanford for 20 years, and great institution. Really enjoyed working with the faculty and fellows there, great facilities. What I got the opportunity to do here is to build a brand new program. And the Center for Cardiovascular Regeneration is, for me, was a real exciting challenge, and it was a new challenge for me. I did bring some people with me from Stanford. I was able to convince about a half dozen people to come with me, and that formed the core of our Center for Cardiovascular Regeneration. Now we're up to about 40 people, and we plan to double that with postdocs and research assistants, and we've some of the new programs that we've got going on. So I got a great opportunity here. Yeah. And the other thing is, being here has been, for me, it's been like an awakening. It's been very energizing because I had this pristine space up in our new research institute that was basically a blank wall. I could write what I wanted on it. And so thanks for giving me that opportunity. One of the things we're doing is setting up this RNA therapeutics program, which is a new direction for me. It does grow out of the RNA core that was funded by the National Heart, Lung, Blood Institute. We were making constructs, RNA constructs, for the stem cell community. And what we're doing here now for the first time at Methodist is to generate RNA therapeutics. So going from research grade RNA, research reagents, and thinking about how we can use those research reagents, apply them for therapy in the cardiovascular arena.
So, next steps. I mean, you've clearly built a spectacular lab. You're doing great work. You're a newbie here. You're a relatively new addition to this organization. What should we be looking forward to for the next 5 years?
Well, I need to grow the program. There's some personnel I need, some skill sets that I need to make this regeneration center complete. For the entire department, what I'd like to see is more interaction between the basic scientists and clinicians. Being a clinician myself, I understand the demands on time with clinicians, but we're trying to make it a little bit more facile for the clinicians and the scientists to get together and talk. We have our retreat coming up where we'll get together and brainstorm a bit. And you and I have put together these Sea Grant Awards that have sponsored some nice collaborations between the basic scientists over at the Research Institute and the clinicians at the DeBakey.
So compare and contrast the advantages and the disadvantages of the traditional academic organization, Stanford, versus what we're doing here at Methodist.
Well, that's another thing that attracted me here. This is a bit of a startup. So I've done some startups in Silicon Valley, so I was intrigued by the idea of doing this startup with you and with Mauro Ferrari. I was impressed by the can-do, roll-up-your-sleeves attitude of the clinicians and scientists here, the leadership, and that actually was very attractive for me. So that's different from being at a big institution like Stanford that's been around for over 100 years, because it's a little bit more difficult to have an impact as a single faculty member. Here, I've had the opportunity to have some impacts on our educational programs, our research programs, and that's been a lot of fun for me to have some major impact. Even processes that form our research infrastructure, I've had some fun modifying those so that it enhances the work that we're doing here.
I want to ask you about Stanford Biodesign program. It's something that I've always been fascinated by. Yeah, we don't have anything like that here in the medical center. I know Bobby Robbins has got this new, incubator to try and foster startups, which could be a major support for that. But tell me about biodesign and what your interactions were when you were at Stanford.
Well, Paul Yock is a friend of mine. He was the first chairman of Stanford's bioengineering department. He created the biodesign program. He is not only an innovator of medical devices for cardiovascular disease, but he is an educational innovator and an entrepreneur. And I've learned a lot from him. This biodesign program that he put together is brilliant. It's been going on for, 7 or 8 years. And what they do is they bring together teams of researchers, basically biologists and cardiac or other clinicians, and people from the business school, and students also from the engineering school. So it's the engineering, business, medicine schools have gotten together. They put up candidates for this program. They form teams. So you've got these teams of clinicians and business students and engineering students working together. What they do is they'll go into an operating room, or they'll go into a procedure room, observe the procedure, observe the operation, and think about what could be done better. They'll go back to a whiteboard and they'll list about 50 things that might be done differently. And then working with an experienced faculty member like Paul Yock or myself, I've been involved in this, narrow it down to one thing that they're going to focus on. They focused on that for a year, and they tried to make that improvement. And you know what? Over a period of about 8 years, I think 24 companies have come out of this program. It's very fertile. A lot of interesting ideas, a lot of interesting devices have come out of this program.
So we need to invite Paul to come and give grand rides.
should.
I'm not sure why I haven't thought of that
Yeah,
before.
yeah.
Why don't you invite him?
I will. He doesn't like to travel much, but we'll convince him.
You can twist his arm. Anything else you want to say?
I know, but just thanks for giving me the
Oh,
opportunity.
you know, you open the doors, you walk through it and taken full advantage of it. We thank you for your contribution to the Heart and Vascular Center. Thanks, John. Appreciate it.